Good afternoon, everyone. Thank you so much for being here. Just 16 months ago, almost a year and a half, the COVID-19 pandemic touched down in Seattle, and our lives were completely upended. We were one of the first in the nation to experience it. We had no playbook and no guidebook, and very little national assistance. So we had to set up programs that we knew would keep the people of Seattle safe. We worked really quickly to launch programs to curb the spread of the virus and to keep our community safe and healthy. 14 months ago, over a year ago, we began our free testing citywide project. And 6 months ago, we did the same thing for vaccines. Thanks in large part to the work and to the Seattleites' willingness to get vaccinated, our city was able to reopen and transition. That's why this week we'll also be doing the next transition and stage, where the city's role in testing and vaccination efforts are going to be transferred to our partners as we turn and focus on our economic and community recovery, and we let our firefighters get back to their very taxing day jobs. I want to join Dr. Durkan and Dennis to emphasize we're not out of the woods. As you have seen, the Delta variant has become the major variant in our area, and we know that if you are not vaccinated, the virus will find you. And we've worked so hard in the city of Seattle, and we're the first to get to 70%. We're now over 80% fully vaccinated, and we're doing 12 and above. But we still know many people in King County aren't vaccinated, and children below the age of 12 aren't vaccinated and are susceptible to the virus. As they are out more in the community, they will be in situations where they could contract it. Since we launched our COVID-19 testing effort in June of 2020, the Seattle Fire Department has administered nearly 800,000 tests, and 1 in 4 Seattleites have used the free testing. And in January 21, Seattle Fire became the first EMS agency in Washington State to start administering vaccines. I have to thank the fire chief. Take a little break here to him and all his everyone in the fire department. Every time we asked them to pivot and innovate it, they did it in remarkable ways. And we are a safer city because of it. You know, we still are, of all the major cities in America, we have the lowest incident of disease, death, and hospitalizations, and one of the highest rates of vaccination. Many people point to Vermont as a state that got it right and they're reopened. I just want to know for the record, Vermont has fewer people living in it than live in the city of Seattle. If we had been a state, we would have been the first to reach 70%. In a matter of months, we launched fixed vaccination sites across our city, including the largest civilian-led one at Lumen Field. Our fire department mobile teams reached nearly 35,000 people just through the mobile teams, the majority of them BIPOC, by going to hard-to-reach locations, working with community-based organizations, and having pop-ups at places where people were, including the ballparks. Thanks to this work and Seattle's commitment to vaccinations, again, we were the first to reach 70%, and now we'll reach 80% fully vaccinated. The testing and vaccinations are still really important. I want everyone who sees this to know the best defense against this virus is to get vaccinated. If you aren't vaccinated, please get vaccinated. If you know someone who isn't vaccinated, help get them vaccinated. If we really focus on that, we will be keeping our communities safer. Rapid, accessible, and free testing, though, is still really important for containing COVID-19. We have to know if people contract the virus so that we can isolate and quarantine and take the steps we need to do as a community. That's why our partners at the University of Washington Medicine are taking over our COVID-19 testing right here at our Soto site and at our Aurora site. There's not going to be any gap in service. People can still go for the free testing. It just means we're going to transition it to the University of Washington, who has been our partner throughout, and Ben is just a phenomenal partner throughout the pandemic. Public health and healthcare providers across our city will continue to provide vaccinations. While we're still miles ahead of other cities, we're not done. And again, I really want to emphasize how important it is for everybody to get vaccinated. If you can hear my voice, get vaccinated. There's just far too many residents who aren't vaccinated. And we are slowly moving from a global health pandemic to, here in the United States, it really is becoming a pandemic of the unvaccinated. You can protect yourself against that by being vaccinated. So please, again, get vaccinated. I really, again, have to thank Fire Chief Harold Scoggins for his incredible work over these last 16 months. But to all the men and women of the fire department who responded as first responders, and the Seattle Police Department who responded as first responders, particularly in the early days when the virus was so dangerous and we and other city workers continued to show up to do their jobs. Every day the Seattle Fire Department is committed to keeping our city safe, and on top of vaccinations and testing, like I said, they had to do their day job, responding to emergencies, putting out fires. As the chief will tell you, those numbers are starting to go up because as we reopen and people are out, we'll see those numbers increase. We would not have been able to reach our goals and our vaccination milestones without the incredible partnership of Seattle-King County Public Health. We have spent hundreds of hours together over the last 16 months talking about what to expect next, how to keep our city and our county safe, and I really have to thank everyone at Public Health for their work. Again, thank our partners at the University of Washington Medicine who have been just phenomenal throughout the pandemic, not just in providing the essential care that people needed in this region, but stepping up with us to do testing and vaccinations to sequence the genomes of the virus so we could see what was developing and what was most dangerous. I also want to recognize Ahana Roy, who's here today, and she is one of our Seattle Youth Commissioners, for making the time to advocate for increased vaccinations for youth. That has been so important. We've seen so many parts of the country lag behind, and I think we can be really proud that we have done all our efforts to get 12 and older vaccinated, but it really has to do with the advocacy that we've had from our youth themselves, so I want to thank her. I want to reiterate, we're reopening, we're welcoming people back, but we're not out of the woods. We still need to be safe. If you're indoors, please wear a mask. It's an easy thing to do to keep yourself safe, your family safe, your children safe, and others in the community safe. And during this incredible summer we're having, go outside. It's the safest place to be, and it's the most enjoyable. And again, please, 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 if you're not vaccinated, get vaccinated. If you know someone who's not vaccinated, show them you love them by getting them vaccinated. And with that, I'll now turn it over to our Fire Chief, Chief Harold Scoggins.
Thank you, Mayor. You know, the mission of the Seattle Fire Department is to save lives and protect property and the environment. We never really know what that means from day to day, but I think the last 16 or 18 months has showed us that, you know, we're capable of standing in the gap in many different places. You know, I want to leave with a thank you to our mayor for trusting the Seattle Fire Department to do this new and different work and a different way to serve the community. And I also want to thank the community. You've trusted us. As the mayor mentioned, close to 800,000 times for COVID-19 tests. There's a lot of trust there, but we think we've built that trust over a long period of time. Each day you call us into your homes when there's a need, and we go there and hopefully we help you in some way, shape, or form. And then with the vaccinations, over 155,000 times you've trusted our personnel to help hopefully keep you just a bit safer. So the community, thank you for trusting us. And to the men and women of the Seattle Fire Department, you have stepped up in such an incredible way. A year and a half ago, I couldn't have imagined we would be operating in these spaces, but you know, as I talked to some of the firefighters who are inside today, and there's no place that they would rather be. They know the impact that they're having. Even on the day that we're announcing we're transitioning this to the University of Washington, there's one firefighter in there who's he's been here every time that I've come here. He's worked here so many days, it's absolutely incredible. So the men and women of the department have really served the community well. And we couldn't have done this without our partners. Our partners have been critical. University of Washington, you've been in this with us from the beginning. Every time Acting Captain Brian Wallace and Sarah Smith had an idea on how to do something, we were partnering with the University of Washington and our medical director, Dr. Michael Sayer, on how we actually make that happen. So from day one, you've been with us. Our ambulance partners, AMR, not only are you picking up patients out in the field on all of our emergencies each and every day, we signed contracts so you can help us in this space too. So there are so many people to really thank, and the city family. Calvin Goins, the director of FAS. This doesn't happen by accident. The real estate division of the city found these types of locations, ordered the supplies, kept the supplies up so we can operate like this. It's been absolutely a city response to serving community. So today is one of those days, or July 31st will be one of those days. It's a bit bittersweet. We know we've done some good work, but it's time to transition and get back to the work that we know we can do really well. So thank you to the community for believing in us and trusting in us. We know it's been a lot. Next, I'd like to introduce Ahana Roy, a Seattle Youth Commissioner, and bring her up to the podium. Thank you.
I want to talk about the important... Oh, yeah.
We want them to hear you.
I would like to talk about the importance of youth vaccination. It may feel like we are going back to our normal lives now, and because of that, youth may not feel like they need the vaccine. But COVID is not completely gone, even if people are getting vaccinated. There are variants of the COVID-19 vaccine, such as the Delta variant, which is highly contagious and can help explain the rise in cases in King County since late June. Unvaccinated people are at high risk of getting COVID-19, and this includes people who can't get vaccinated, such as children under the age of 12 years old. It's important that as a community we do what it takes to get life back to normal, and that includes taking appropriate measures such as keeping ourselves and in turn others safe by getting the vaccine. It has been hard for many to be isolated from their peers and struggle with academic success learning from home. To prevent this from happening again, youth are an integral part of our community effort to get things back to normal. To stop COVID-19 from spreading further and to keep ourselves safe, please consider getting the vaccine and considering your peers to do so. This is an important effort that will take all of us to engage in. Thank you so much. Now I'd like to introduce Director Worsham.
Thank you. Great job. Thank you, Ahana, and important message, carrying that message today. So hello to all of you at the media. Just great to be here today with such distinguished guests as the Mayor and the Chief and Ahana with this important message that we have about where we're at right now in the COVID response and the good work that we've done. It's hard to believe January of 2020, what hit us and what was coming and where we've been in the last several months. It's been a long road. It's been an incredible ride for many of us, but I just really shout out to the City of Seattle, the Mayor and the Chief in particular, who have just done an amazing job in partnering with public health and working in concert to be able to stand up as quickly as we can, testing when needed, vaccines when needed, and wherever the need is. We have definitely become national leaders, both as a county and a city around this work, and we have a lot to be proud of. But as the Mayor said, we are not out of the woods yet. As we've been hearing in recent days, much about this Delta variant that we have seen really quickly sweep in and become a dominant strain here in the Northwest and across our country. It's very challenging, it's very infectious, and it's causing us to pause and understand what we need to do to ramp and continue to be safe in the work that we're doing. The important thing that we know, as opposed to what we knew in January of 2020, we have a lot of tools in place, and we know what is going to help us get through this once again and shut this virus down in our community. I'm going to talk a little bit about those three. In particular, the Mayor very, very eloquently called out the importance of vaccine is our best tool that we have in our shop right now. If you're not fully vaccinated, to get vaccinated and prioritize that in your life, and the lives of people are important to you. I think it's important to understand when we talk about 80% people being vaccinated across the county, It sounds like a great accomplishment, and it is, but there are 700,000 people in King County who are still not vaccinated. It's a very large number. Of that 700,000, 400,000 of them are eligible to be vaccinated and have not been vaccinated. It's a big number, and we need to do everything we can in order to be able to bring that number down. And what's important, and I think that sometimes gets lost in the message, is that we have 300,000 young people across here under the age of 12 who are not eligible to be vaccinated. We also have a responsibility to protect our young people from being exposed to this virus as well. We need to continue the vaccines. We need to squeeze down all of the opportunities we have for this virus to be spread from one person to another. It's very, very highly effective in its transmission. The vaccine is really showing to be holding us strong in protecting us against serious illness and hospitalizations, and it's an important tool that we have. We are working with our partners, medical providers, the city, with public health, doing what they can, and our community partners to get our vaccines out. We're looking at neighborhoods, we're looking at zip codes, we're looking about where people aren't vaccinated, and taking the vaccines, making it the easiest thing we can do for people to say yes to a vaccine and the work that we're doing. In addition to the vaccine, we need to wear masks. We've heard a lot about this in the last couple days. A directive that has come out from Dr. Jeff Duchin from our Public Health Department in King County, in the city of Seattle. Put a mask on if you're going to be in a public place and indoors and exposing other people. We need to shut that down through vaccines. We know they're effective. We know they're easy. We've done it before. We can do it again. And of course, the CDC coming out yesterday with its new guidelines around around mask wearing in public spaces if you are a high incident area. And we are moving into that space now of be considered high transmission area. Lastly, as we are here today talking about the transition of testing also remains an essential tool. Themselves with symptoms, whether they're just super mild, still need to get tested. And the reason that's still important for two reasons is one is to know and seek the medical care that you need if you are symptomatic, and most importantly is being able to stop that transmission if you know that you're infected to other people, to family members, and to the people you work with in the community that you socialize and recreate with is important. So getting tested is an important tool that we continue to have. It is important, and as the mayor has mentioned, this site will remain open. We appreciate the city's quick ramp up with this site, and now handing it over to the UW system for the work they need to do. There's other places throughout the county that free vaccines are available. Get onto our public health website. You can seek those out. It doesn't matter regarding your immigration status, whether your insurance status. You are eligible to get a vaccine of no charge. It is an important tool of the three that we have. So get vaccinated, wear a mask, and get tested if you have symptoms. I'm going to turn this back over to the mayor.
Thank you so much, Dennis. I just think we're reminded again that this virus is tough, it's innovative, and it's deadly. And we've got to use all the tools we can to be smarter and more innovative than the virus is. Any questions?
Mayor, I'm curious. You know, we've seen several restaurants close down over the weekend because of COVID cases. Employees that need to be tested. We're hearing about companies that are saying, hey, if you're not vaccinated, you need to be tested weekly. How are we going to handle that testing capacity here in Seattle?
So I think it's really important. It's a great question. The question is, how are we going to handle the testing capacity when we know this virus is still here? There's businesses that have been faced with it. Some businesses are making the decision you have to either be vaccinated or tested regularly. Everyone should know we're not stopping testing. These testing sites will continue. All we're doing is changing the management. And we're turning it over to somebody who's been a partner with us from the beginning, the University of Washington. So it's still really critical, as Dennis said, who's the head of Seattle King County Public Health now. If you have symptoms, get tested. It's the only way you can be sure whether you have COVID or not. And we're seeing more and more people have mild symptoms. And if they have mild symptoms, some people say, oh, I don't need to be tested. You can still give it to other people. That's what's critical here. And that's why wearing the mask inside is so important, is that even in those breakthrough cases, we're seeing that the vaccines are doing a really good job of protecting people, most people completely, but even the people where they call the breakthrough cases, they're getting much more mild cases. Sometimes they won't even know that they have it or the symptoms are rare, but they can still give it to other people. That's why wearing the mask is so important.
What if we need more testing sites?
You know, we have been adaptive and innovative. If we think we're going to need more testing sites, we'll set them up and we'll get it done somehow. Every step of this pandemic, we've been looking to the horizon, thinking, where are we headed next? That's why weekly I meet with the public health and the King County executive to say, what are we seeing? What's changing? How do we adapt? And so we will continue to do that for the months to come, because we should expect there could likely be an uptick in the fall. That's what all the public health officials are predicting. It's also going to be flu season. Last year we had almost no flu season because people kept away from each other and wore a mask, washed their hands, used 1 million tons of Purell. And so we need to take those steps again to remember that, you know, keeping each other safe and healthy is going to be more important than ever before.
Mayor, with this huge accomplishment with the vaccination rate in Seattle and King County, and then the unknown with the Delta variant, today the Governor Inslee said that 96% of the cases in our state now are the Delta variant. What does that look like from your position? Something to celebrate with the week, but so much unknown still ahead of us.
You know, we've been saying all along, and I think people heard me earlier this year when we first saw the Delta variant, that we had to assume it would become dominant. And we had to plan for that. So that's what we're trying to do by looking at the science. And one reason why testing is so important is it gives us the opportunity to see how widespread it is. And we live in one of the most fortunate regions because we have the research facilities now that can do the genotyping to see which variant it is and which is becoming most dangerous. So it is, you know, look, as I said, this virus is very adaptive and innovative. And one of the things we have to also assume is, you know, America is enormously privileged. Anybody who wants to get vaccinated can. That's not the case in much of the globe, and particularly the southern hemisphere. We will expect other variants to emerge because the diseases will become more rampant in those areas where there's no vaccinations. So we are planning for and expecting and watching the horizon to see what the other variants are doing, seeing how their vaccines hold up against them. So we'll, you know, this pandemic has taught us that we really have to plan for the worst, but go on our lives and really do what we need to do, both to keep people safe, but also to live our lives. Thank you.
So is international travel currently, as we talk about the Delta variant, international travel right now is pretty much non-existent. A lot of people coming up to the Pacific Northwest because it's, I mean, why else wouldn't they? Are you concerned at all about people coming up, visiting from these states like Texas, like Arizona, who may bring strands with them?
You know, I would say we've been watching that from the beginning. The question was, you know, international travel is very limited. The president just continued the travel ban for foreign nationals to come to the U.S., but we're seeing a lot of travel in the U.S. There's a lot of pent-up demand, and we're having over 300,000 visitors a day to Seattle. So we've been working really closely with our healthcare providers to see if we see an uptick in hospitals and what we need to do there. Because people are coming from other jurisdictions, they'll bring the variants with them. Remember, this started with just a few people who happened to go to China and come back here. And so we know how transmissible this can be, and we've got a plan for that. I want to urge people, if you're smart and you're vaccinated, out and spending time outdoors, you can come and downtown Seattle, business districts, to restaurants to be safe. But if you're going inside, please wear a mask.
Sorry to don't mean
That's
to
all right, you
monopolize.
get to.
So as we talk about all the resources that the city has spent since this started, all these testing sites, vaccination sites, you have a rough, I know you probably don't have an exact number, but a rough cost on how much the city has spent, and then looking forward to fall, expect possibly to spend more resources throughout the city?
You know, we'll get you the totals, but it's a significant amount. And we prioritized it from the beginning. At the beginning, we were just having to use city resources themselves. As the federal government aid came in, we were able to use some of the CARES Act dollars and now some of the rescue dollars to do some of this work. But it was my view as mayor, we didn't have a choice. If we didn't prioritize first testing and then vaccination, we couldn't protect our community.
My colleague Jonathan Cho, if you don't mind. Anybody else?
Anybody else on vaccinations testing?
I'd love to get into the fire chief if I could.
Yeah.
I'd love to ask.
I want, before Brian Wallace walks away, he and Sarah, Those two have been such stalwarts. If you don't have their names on your speed dial and haven't done a story on them, you should do a story on that. With that, I'm going to turn it over.
Chief, I want to ask, I've visited some of these sites over the past couple of months, and it seems like every firefighter I came across was, like, as you said, excited to be there, happy to do the job, not only to do the job itself, but also to interact with community members. As you see this happen, how does that make you feel about the department as a whole, and knowing that these men and women really responded to the call?
Yeah, absolutely. You know, it makes me proud. But I know who we are as firefighters. I know who we are as professionals, and I'm proud every day. Just so many other people are getting to see it right now. You can't imagine the number of emails, texts, and phone calls that I've had from people in the community that said, "Hey, Chief, we went to one of the testing sites today. Let me tell you how incredible your people were." For the last 15 months, I've heard that consistently. But that's, I'm incredibly proud. And that's why the thank yous are so important they do, and standing in the gap of it, but every single day. So thank you for the question.
Yeah. I'm going to follow up on that. You know, coming in as mayor, I will tell you that if I'd started at the beginning of my administration and not knowing there's a pandemic, saying we're going to set up testing facilities and Lumen Field, we'd still be working on the process. You know, but our city in an emergency turned a corner immediately. We were able to get hot meals to seniors. We were able to get money to businesses that were closing. And we stood up the largest civilian-run vaccination site in America. Thousands of volunteers, hundreds of thousands of items that had to be inventoried and replaced every day. And we were able to stop testing sites like this. So I think people should also be really proud of how their government responded to this. Not just the government, though. It really depended on the community standing up and doing what they needed to do. I think we're the only vaccination site that had 2 Olympic athletes as volunteers, Sue Bird and Megan Rapinoe.
And I just want to ask this quickly, since it wasn't addressed. Will testing still be available for the non-insured?
Yes.
Free testing, rather?
Yes.
Okay. And a final follow-up. Would you consider bringing Andre Taylor back to deal with the gun violence on Seattle streets?
We just did a large RFP where people competed for the gun violence, and we're in the process of doing those awards. Thank you.
All right, thanks everyone. Can we do a quick group picture? Maybe right in here?
Yeah.
Yeah, background.
I know. I'm showing off.
And I've got a 14 print.
Oh, well, I'm sorry. I think I've got you beat.
Okay, you're right there with me.
I'm like,
There's no way I could have saw it.
Yeah.
I was thinking about that one.
Thank you for coming out. Very, very